Hey, this is Jim Otton. I am a clinical pharmacist with Shields Health Solutions, the Pharmacy Podcast Network.
You're listening to the Pharmacy Podcast Network.
Improving lives and elevating performance is at the heart of everything Shields Health Solutions does as one of the largest integrated specialty pharmacies in the nation. The Shields team dedicates their patient support programs, experiences, and data platforms to help reduce costs, achieve better clinical outcomes, and accelerate system-wide growth. This is the Shields Health Solutions Special Podcast Series.
Specialty pharmacy is such a special part of our network. We work with the NASP on an ongoing basis to bring members of the National Association of Specialty Pharmacy to really talk about more specific issues, especially like around treatment. And one of our founded partners giving us some amazing information is Shields Health Solutions. We've been reviewing several disease states and conditions. Today, we're going to be focusing on hepatitis C. And really, when we look at some of the global statistics, an estimated 58 million people have chronic hepatitis C virus infections, with about 1.5 million new infections occurring per year. So having pharmacists and our pharmacy teams plugged into this treatment, continuously gathering data about this treatment and outcomes is so important. And I'm so excited to welcome back Dr. Jennifer Donovan, part of the Shields Health Solutions team, back to rounding out this series. And let's talk about hepatitis C today, Jen.
Yeah, glad to be back here. Thanks for having us, and glad to have my colleague and expert pharmacist Jim with us today as well to talk about Hep C and the great care that he and the many others pharmacists at Shields provides to these patients and many others.
So your story, Jennifer, we want to hear from Jim. Jim, tell us about why you wanted to become a pharmacist and how you've become a sought after expert in hepatitis C treatment.
Sure. Well, I've always wanted to do something in healthcare, and at the time, I was talking to one of my dermatologist who had been in medical field for such a long time, and he was like, "Don't do something where you can actually make an impact." And that's why I got into pharmacy. I've been a pharmacist for 25 years now. I've run the gamut from, being a pharmacy manager to a district manager to everything. And I really love being in specialty. I feel like this is where, like what we went to school for and what we're meant to do as pharmacists, to be able to engage with the patients in the way that we're able to.
Yeah, Jim, I think you're spot on. I think one of the things that has drawn me to specialty pharmacy and to Shields, I too have had many different hats and roles in pharmacy, which is, I guess, one of the blessings of the profession. There's so many things you can do, but there's something that has always resonated with specialty pharmacy where we get to really directly apply our medication knowledge, our connection with patients. And for me, with Shields, it's all about the patient and putting the patient first, which really invigorated me again these many years later. So it's great to hear you had kind of a similar journey as well.
So we have stats that show us about 2.4 million people have hepatitis C in the United States. We were talking about some of the global statistics. And, that's not so much shocking to me, just based being in pharmacy for so long. I've heard so many statistics. The stat that did shock me, which is 51% of the people living with Hep C do not know that they have the virus. Jim, open up that can of worms for us and tell us what is going on that some of our people don't know that they have this disease.
Where I think a lot of the opportunity is just through regular screening and identifying patients in groups where they're more likely to have experienced it. I think one of the things is a lot of patients that are infected with hepatitis C don't really show any outward signs until they're screened, and a lot of the times when they do show signs, it's pretty far along, and that's one of the things that I think as healthcare professionals, just having that conversation, and patients that are more prone to being infected by it, having those conversations and just being open and honest, and just making sure that we're screening everybody that we can.
Jennifer, I think of your experience in our conversations about other disease states, and we always came to a point in the podcast where we were starting to talk about medication adherence, which is very important, obviously, but it's also catching the treatment and starting the treatment as early as possible. Talk to me about the stages of Hep C, and if we do detect early, is there a difference in treatment success and treatment outcomes?
Yeah, that's one of the great things of where we are with hepatitis C treatment, is that it's curable. And I don't think we've been ever able to say that in a very long time, if ever. And so we have these amazing medications, and starting them early is key to preventing those long-term complications that Jim started to allude to. And so screening is certainly one part of that. Getting these patients on the medication is the next step. And then keeping them on the medication, because they are so effective. But how do we help ensure the patients continue their treatment so they do have that cure? Because that's ultimately what we're trying to achieve here.
Are there segments of treatment in the world of hepatitis C where specialty pharmacy becomes involved, that you go from one medication to the next in order to reach that cure level? And is there some kind of titration schedule that is part of the norm, or is it specific to each individual patient? Jim, I was wanting to ask you, since you have experience in that.
There's multiple factors when you're looking at treatment. One of the things that we look at is genotyping, with specifically what type of hepatitis C virus they have, and what drugs it may be resistant to, or what drugs it may respond to. Also, we look at if patients have been on treatment prior, and if they failed, or if they've been reinfected, and there's a lot of factors like that go into it. For the most part, patients that we screen and catch in the early stages, it's usually one treatment, depending on the genotype that they're using, the genotype that they have, and the medication that we decide to treat them with. It's anywhere from 8 to 12 weeks of treatment, and that's it. And that's one of the things I love about working with these patients is, you get to tell them, like, hey, if you stick with this for 8 weeks, 12 weeks, whatever it ends up being, you're done. And that's such a satisfying thing, because as Jen said, we don't often get to sit down with somebody and say, we're going to cure you, and that's one of the things that I love with working with these patients.
Jim, I recall a story that you had shared with us, kind of one of the things that you talk to your patients about, kind of stick with this, kind of like a pep talk a little bit, right? Stick with this, continue with their meds. And at the end, like, do you want to share that a little bit? Because that was really cool.
This is your graduation celebration present.
Yeah, I love that.
So a lot of patients, so hepatitis C is a bloodborne virus, right? You're infected through contact with infected blood. So what a lot of patients don't realize is that they can accidentally reinfect themselves if they have their grooming tools that have the virus shed on it. So, like, if you think like your toothbrush, your razor, your nail clipper, anything that you have. So I always tell my patients, on your last day of treatment, go out and treat yourself. Go replace all your grooming tools, get a new razor, get a new toothbrush and celebrate that way. You've gone through this, and it's a fun little way just to get them engaged and also make sure that they stay, cured after the fact. Jen, I actually forgot to mention, I years ago once had a patient, and he didn't realize, his brother had hepatitis C also, and his brother had no risk factor, nothing that would have, and what we found out is they were sharing a razor, and that was so eye-opening, and that was one, so that I really make sure now that I make sure I punctuate that point of like getting rid of all that stuff at the end.
Yeah, no, it's a great point. And it's something that I think so many of us would go unnoticed and really, not think of. So I think it's a great one to kind of remind folks so they don't reinfect themselves, but also a great like graduation moment, like you said, like it's a great pivot from I've completed therapy and I'm cured. So I think it's you always said it in such a nice way for our patients.
Doing some research and preparation for our interview today, Jennifer and Jim, I find hepatitis C to be very strange in comparison to other viruses. And reading up on some of the information that we pulled from the World Health Organization, the last point in some of their specific information is kind of like that general information. The last point says there's currently no effective vaccine against hepatitis C. That's such a head scratcher for me with the advancements in vaccines over the years. I would have thought there's definitely, a vaccine out there. Describe to us, how are people typically contracting this virus, and also any feedback to the ongoing research around vaccination?
Sure. So like I mentioned, it's a blood-borne virus. So people who use IV drugs, if they're not using a clean needle exchange program, through sexual contact, like I mentioned with the patients that were sharing razors, those are some of the ways that can be it's contracted.
During this series, we have always come back to the obstacles and how specialty pharmacy helps to remove those obstacles. More specifically, the research that Shields Health Solutions has put together. Jennifer, financial assistance. If we can't get our patients treatments, programs, if we can't get those programs paid for, that is a deterrent to getting people on therapy and in treatment, and in this case, cured for hepatitis C. So talk to us about financial assistance and the strategies that Shields Health Solutions puts into place.
Yeah, no, you're absolutely right there. And in 2022 alone, we secured over, just about $10 million in financial assistance for patients with Hep C. And, for folks who have a condition that can be cured, we don't want cost to be one of those barriers for their success. And so our team of liaisons and others within Shields work with the providers, work with the insurance companies to ensure that whatever financial assistance is available, the forms are complete. If there's a prior authorization that's needed, they work to help complete those, and really just expediting that time to therapy. We're really proud that, within, 2 days, we're able to have a patient start their therapy. Again, we talked a little bit earlier about starting it as soon as possible. So breaking down the barrier of cost, getting folks on therapy as soon as possible is something that we pride ourselves on, and our Hep C patients definitely benefit from that service.
Jim, what other obstacles have you experienced in helping patients that have Hep C and really helping them to look ahead and navigate some of the things that might prevent them from either starting treatment, staying in treatment, or getting treatment paid for?
I think some of the obstacles that I personally run into is with a lot of these patients that are infected, sometimes we have an unhoused population, and getting them to be able to pick up their medications and get started on them. With the particular partner that I work with, we have them come into the clinic where they're able to get, counseling and adherence check-in so that we make sure that they get started and stay on. Aside from that, typically side effects, which fortunately, or actually fear of side effects, I think, for patients, which fortunately for most of the medications now that we use to treat hepatitis C, they're minimal, gastric upset, diarrhea, those uncomfortable side effects that patients don't want to deal with that can sometimes impact their quality of life. But being able to say, like, hey, you're just going to go through these side effects for a week or two, and in general, you just have to get through this for 8 weeks, and then you're done and cured. That really helps overcome the adherence issues with this particular disease. And like Jen mentioned, these medications can be so expensive, but our team does a really great job of getting them, copay cards and financial assistance and grants and all of that. And that really can help with that as well.
Jim, as you were talking, one of the things that stood out there as a barrier to me, once we get patients started, we get them on the right medication, is just having to deal with some of the social factors that can impact whether that's access or picking it up or getting to, a doctor's appointment. And I think what the team does really well is trying to identify those barriers and working around them. So in the example you shared, having them pick it up at the doctor's office if they can't have some medications delivered to their house, as an example. So really finding ways to not only get access, but continue the patient on that therapy. So, that completion rate is so important for successful outcome. And I think you highlighted some ways that we address those barriers.
I think too, with the way our model works, we speak to the patient, right about the time that they start, either, day before, day of. We follow up a week after to check in to see if they've been experiencing any side effects, because sometimes patients just suffer in silence and think it's not a big deal. So that first check-in that we do a week later is always helpful, just to catch anything before it blossoms into something worse. And then, we check in midway through the treatment to make sure things are going well. So I think all of those touch points that we have, and we develop such a relationship with them that they feel comfortable calling us with questions, and they have access to us 24/7 if they need to call. So I think that's another way that it's been pretty helpful.
Jen, I think of pharmacists in specialty that are in disease state management that is longer than what a community pharmacist might come into contact with, filling a prescription that may not be a lifelong medication. It might be temporary. And in this case, Hep C could be temporary, right? Especially if you get on it right away. However, there's the factor of comorbidity. So let's talk about dealing with other serious conditions, ongoing conditions that are going to need treatment that coincide with Hep C and having Hep C.
Yeah, no, you're exactly right. There are a group of patients that this might be their only condition that can be cured, but many times we see that patients are also co-infected with HIV. And, to that point, these patients, although will be cured from Hep C, they'll still require care and engagement by our pharmacist team for their HIV treatment. And that too is very effective, but, we want to make sure that it continues to be effective. So establishing those relationships are important regardless of how long the therapy is. And these patients can continue on with us in that setting as well.
Jim, Shield's care continuum has a very specific model that they put into place to assure that a patient doesn't fall into the cracks. And those cracks could be an ecosystem of many things. We were talking about payment obstacles. We're talking about getting people on treatment fast and, in keeping them on treatment. But talk about that cycle, our engaging of the patient, our intervening, our coordinating, our enhancing and renewing. Why does this cycle work so well? What is it about this track that you're managing patients on that really helps to get the best outcomes?
I think one of the things that works so well with this is that we have so many people just looking at this one patient, and all of us focusing on a goal of getting them through the treatment to completion. Our liaisons start off the process by introducing services, getting them set up with financial assistance, taking care of their refills. So we have them checking in on a regular basis. So if somebody isn't refilling on time, or if they mention they missed a couple of doses, they let me know, and then I can step in and see if I can get to the root cause of what the patient is experiencing, why they may have missed a dose or catch something beforehand. We're integrated with the healthcare system, so we're able to communicate seamlessly with their doctors and nurses and let them know, like, if I come across something that they mention in passing, like if they're struggling to, with housing or getting a meal or whatever, I'm able to contact their social worker. So we're able to treat the whole patient, and make sure that they have all of the things that they need to support them to get through this. And like I said before, with our regular check-in calls, we learn a lot, and we have the time. We're afforded the time, which a lot of pharmacists don't get, to have conversations with these patients. Like, there's no, like, I spend a 20-minute phone call, half hour, talking to these patients, which is not something that they're getting elsewhere. And that's when they're really able to open up and share what's going on, and we're able to identify any issues that are going on.
And just to add to that, Jim, I think one of the hallmarks of this cycle, if you will, this flywheel, is that our outcomes kind of speak for themselves, certainly our patient outcomes. But then when you think about patient satisfaction, as an example, our net promoter scores have been above 80 for many years. And I think that's an indicator of patients liking and wanting and recommending our services to others. And looking across other industries, it's very unheard of to have such a high score. And then similarly, our providers, they're also kind of part of this cycle, and we want them to be pleased with our services and satisfied. And just about 90%, a little over 90% of providers say they have a seamless experience and would recommend our services to their patients. And so I think that's just a great testament to the work you and the liaisons do at Shields.
Dr. James Otton, Dr. Jennifer Donovan, this has been a very special recording. We want to thank you for sharing your experience in managing a complex disease state that, if you don't get on top of it, can really cause some major issues, especially with our livers. So thank you so much for being part of this episode, and we hope to work with you further down the road in 2024.
Thank you so much, Todd. This was a pleasure.
Yeah, same. Thank you so much.